Hello all of you, welcome back to my channel and let's get together with this video back again with the anatomy PYQ solving session. So let's start with our video with the first question with the image based question. So this is the histological based image. What is this? You have to tell this. What is this? Choices are this. Yeah, I hope you know the answer. It's the glomerulus. Yes. What is the explanation behind it? What glomerulus do? Glomerulus is a filtering unit, right? Filtering unit of the kidney, and it is a specialized bundle of capillaries that are uniquely situated between two resistance vessels. Now these capillaries are contained with the Bowman's capsule. What glomerulus do? Glomerulus. Yeah, it is a filtering unit. First you have to know this. Yeah, okay. Now it is between two resistance vessels. You know this. What these capillaries? There is the capillaries. Contain what? Yes, Bowman's capsule. Okay, and they are only capillaries beds into the in the body that are not surrounded by the interstitial tissue. This unique filtration barrier contains three histological structures. So what this contain? Three histological structure. First is capillary endothelium. This. Okay, capillary endothelium of the glomeruli. Specialized cells of podocytes, correct, and the fused membrane of both cells. Now you can see this glomerular basement membrane, podocytes is there, intraglomerular mesangial cells are there. Okay, so I think this is clear for you now. Now let's come to the another question. That is a patient with abdominal pain. Now a patient came to you, abdominal pain is there. Okay, jaundice is there, and portal hypertension is observed. Now which veins are involved in the anastomosis in this condition? So you have to tell the answer, and answer is yes, esophageal veins and left gastric veins. Very correct answer. Now let's see this. Varicose hemorrhage is the most common complication associated with portal hypertension. You have to know this. Okay, 90% patients, what happened? 90% patients cirrhosis develop varices. Okay, sorry. And approximately 30% of varices bleed. The estimated mortality rate of the first episode of variceal hemorrhage is 30 to 50%. You have to remind one thing: most common variceal hemorrhage is associated with the portal hypertension. Left gastric vein is formed by the small veins that drain upper portion of the stomach at the level of the lower esophagus. Left gastric vein turns posteriorly and medially and passes behind the lesser sac. Along this course, left gastric vein receives? It receives several tributaries, which drains both sides of the upper half of the stomach, fundus of the stomach, and the abdominal portion of the esophagus. These tributaries include the small gastric and lower esophageal veins. Now let's come to the portocable anastomosis. Portocable anastomosis, what is do? It is between the left gastric and lower esophageal veins, and it is important to, as it provides the alternative routes of the circulation when there is a blockage in the liver of the portal vein. So what is the portocable anastomosis? It is between left gastric and lower esophageal veins. What it can do, it can provide you the alternative routes of circulation when there is a blockage in the liver of the portal vein. Now, if we put simply, it enables venous blood from the gastrointestinal tract to still reach the heart through the superior vena cava without going through the liver. Let's come to the another question. Which muscle is indicated by this arrow in the image? What is this? What is this, guys? Tell me. Yeah, trachealis. What it covers? It gives the it completes the C-shaped rings of cartilage. Okay, so the trachealis muscles lies posterior to the trachea and anterior to the posterior to trachea and anterior to esophagus. What it do? Bridges gap between C-shaped ring of cartilage at the posterior border of the trachea adjacent to the esophagus. This completes the ring of the cartilage of the trachea. This tracheal muscle also supports thin cartilage on the inside of the trachea. It is the only smooth muscle present in the trachea. So this is the smooth muscle. Now you can see this. There is a trachealis muscle. This is the trachea, mucosa, submucosa. You can see this diagram properly. This is the C-shaped ring of cartilage. Let's come to another questions. We have to complete this as early as possible so you don't get bored. I really don't want you to get bored, really, and I really don't want it to take much time of you, so you will skip my video. That's why I'm just focusing on the questions. I'm not focusing anything else over here. Okay, let's come to the different thing. After a 25-year-old female underwent parotidectomy, she developed drooping at the corner of her mouth. Okay, which branch of the facial nerve is likely responsible for this? Exactly, temporal branch. It occurs when cranial nerve 7, which is the facial nerve only, is injured. The facial nerve is responsible for stimulating the muscle for motions in the face. Buccal branch of the facial nerve or cranial nerve 7 provides motor innervation to the orbicularis and elevators of the lip and lip angle. The majority of muscles responsible for depression of the lip are supplied by the marginal mandibular branch of the facial nerve. You can see this. Temporal branch is what covers frontalis, orbicularis, oculi, corrugator, supercili. Zygomatic branches orbicularis, oculi. Buccal branches orbicularis, oris, buccinator, zygomatis. Marginal mandibular branches what it covers mentalis, depressor labii, inferioris, depressor anguli, oris. Cervical branches platysma. Let's come to the last question, but not the least. This series is still going on and I will be definitely beginning back again with another subject too. So you have to connect with my channel anyhow. Which of the following is not considered a branch of the facial artery in the face? Focus on not. Okay, so answer is mental. Okay, the facial artery is a major vessel originating from the external carotid artery that primarily supplies the face's superficial structure. This artery ascends from the neck to the face, traversing significant anatomical landmarks such as the mandible and the mouth's angle. You have to see this. There is everything in this image over there. All arteries, external carotid artery, common, internal, occipital, maxillary, angular, dorsal, lateral, facial, labial. Okay, submental branch, supraorbital. So I have covered the images also from this question series. So you will be getting more and more question covered with one question itself. Right? So thanks for watching my video, and do share it with your friends, do share it with your batchmates, help each other, study together. This will make a difference. Don't get stressed enough, just focus, just do hard work, and it will definitely pays back. So you just have to give your best, else depends on your destiny. Thanks.